Relationship-based care is a caring model that focuses on the relationship with patients and families, with our peers, our colleagues, other members of our caregiving teams and our support teams, and then of course care of oneself.
We operate with the concept that most folks really don't want to be in the hospital. They're in the hospital because something has occurred unexpectedly in their lives. So we have an opportunity to be ambassadors of goodwill. Every day our young people get to go and work with someone who is someone's mother, father, brother, sister, grandmother, grandfather, whatever family member. And that means really going and reaching and connecting with them as a person.
What we have implemented is the first 5 or 10 minutes every day, you sit with the patient at eye level on the chair and you ask them their goals for the day. The patient's perception when you sit down with them and you actually take the time, even if it is 5 to 10 minutes, they feel that you've actually listened to them and they've been heard.
I want to try to make sure they know, you're not just coming through an assembly line kind of procedure. You want to take that extra time to explain to them and what's going to happen.
We have to come to a point where we can foster a sense of, that they have a sense of trust in us.
I believe that trust can also help for the healing.
So if something does potentially go wrong with whatever, something's late, a lab test, a scan test, they know you and they have trust in you because you've developed that relationship.
I have a lot of patients sometimes that they get upset when co-workers just go in there and start doing whatever they're going to start doing, and they're like, wait a minute, what are you doing? Who are you? When I walk into a patient, I like to knock. I walk in, I introduce myself, and I tell them who I am, why am I here.
Just talking with some of the family that's in there, I think that's really important too, not just the focus of the patient. I also think it's the family around them, so they know that we care too, and we're not just doing our job.
One of the ways you might say, you might walk into a gentleman's room, you might notice some sports memorabilia. It might be your team, it might not be. It's actually a lot more fun when it's not your team. So you really personalize the individual. They're not a job or a task that has to be accomplished, but they're people going through a real life experience in a place they really don't want to be.
People don't come to the hospital because they want to. They're being brought into the hospital because there's something wrong. So they're scared. So we need to remember that they have fears.
And just by smiling and touching their hand or holding their hand sometimes, it's not even really giving anything but your time and your presence is enough to just make them feel like they matter.
We had a patient, he was blind and he also was bedbound, and he was not able to walk at all. So I witnessed a nursing assistant who did go in the morning, and she sat with him and she fed him one-on-one, and she just sat there and listened. That's all she did. And at the end, I overheard him saying how much he appreciated it. He said she was the only one who actually listened to him, and he felt important and significant.
Everything we do is based upon team. To us, team means that together everyone achieves more.
There's really no such thing as the "that's not my job" statement, because we find that you kind of encompass all roles when you're caring for a patient.
If my group's not that busy, then I'm going to pitch in and I'm going to help the other nurses give pain medicine, do admission paperwork, just whatever I can do to help so that we're all working together.
You don't have to wait for somebody to ask you. I always make sure that for the nursing assistant, for our nurse, even the housekeeping, the secretary, I always make sure that I'm there with them, helping them, and I want them to feel that they can rely on me.
Like if our dish room gets backed up, we have no problem rolling up our sleeves and helping them scrape trays to get them washed so we can redo the cycle all over again.
The days that everybody works good together, you just have better days. The patients are happier, the family's happier, the staff is happier, and it just leads to a better work environment.
Self-care is key, because if you come in and you find yourself to be in a less than stellar mood or place, it can definitely impact the kind of care you give to your patient.
I take care of myself by exercising. Makes me feel good about myself. It helps relieve stress, and it just gives me more energy to get through the day.
I love to read, and reading is one of my most favorite things to do.
We have taken up Zumba. It kind of incorporates kind of yoga at the same time at the end. So mentally and physically it makes you fit, and even like going to work, you have more energy.
If you're good and you're healthy, then you're going to be able to develop healthy relationships with your patients.
My husband was out jogging and we couldn't find him. Our daughter called Saint Agnes and they said, yes, we picked up a gentleman, he was jogging, we had to resuscitate him, you need to come immediately. So that started our journey. From the time